So we've had a lot of cases connected to fast food restaurants in the Kingston area specifically. Could you tell us a little more about what's happening?
So in KFL&A, in the last 2 weeks, we've had a sudden rise in the total number of cases within our region. And when we did our active investigation, we found that 15 of the recent cases, and we had a peak of around 40 active cases, were workers, and they happened to be working in the fast food industry at 10 different locations across Kingston. And that raised some concerns of whether we knew actually how widespread COVID-19 could be in our community, given that it's a very aggressive virus and spreads rapidly from one person to around 3 people. So we did our analysis. It's only in Kingston we found that this was happening. It was across the city, so it just wasn't in the downtown core. It was across our jurisdiction. Clearly, people working in this industry were under 30 years of age, and we have talked to them and spoken to their high-risk contacts, and that group of individuals is now at home, isolating themselves from others. So in total, we had around 31 cases today with over 300 contacts that are isolating themselves from others. To get a better understanding of what's going on in the community and how or why this virus is spreading so quickly in this age group working in this industry, we have made a recommendation. It's voluntary that anyone working in that industry could get tested at one of our assessment centers in Napanee or Kingston, even if you don't have symptoms. So if you're symptomatic, absolutely you should stay at home once you're tested till you get your results back. But because this is a surveillance assessment, if you don't have symptoms, you can still go to work and await your results. But generally speaking, our lab is great locally, and our turnaround time for results is often within 24 hours. So we think this is going to help us further understand if there's any other risk to these workers or to these businesses. We do not think there's any risk to the public because of all the precautions these fast food outlets have put in play. And we've visited them to ensure that they're being adhered to. So the plexiglass is there, the physical distancing is there, and the exposure is mainly behind the plexiglass in the workspace itself. And many of these workers could have actually acquired it because of social networks that they are in. But in an abundance of caution, we'd like to get a little additional information and want to thank the community once again and all the workers that will be taking time away to go get tested. And thank them. We hope to have test results back to further understand if there's any other additional risk in this workplace, in this age group, and to ensure that the businesses can stay open safely.